Hello, my name is Inês Nunes da Cunha and I am the FIP Practice Development and Transformation Manager. Welcome to this CP debate about the Heart Failure Pharmacy Toolkit. Before we dive into the main content, let's take a moment to go through the learning objectives of this video. By the end of this session, you should be able to describe the global burden of heart failure, HF, and its risk factors, recognize the critical role that pharmacists can play in early interventions of heart failure, identify opportunities to raise awareness and screening of heart failure, particularly among at-risk groups, and understand how to integrate the Heart Failure Pharmacy Toolkit into practice. This video provides a brief overview of heart failure, its burden, risk factors, and links to other chronic diseases. Then, we will highlight the important role pharmacists can play in supporting people at risk or living with heart failure. And finally, I will introduce you the Heart Failure Pharmacy Toolkit, a practical resource developed to support pharmacists in this area. Heart failure is a condition where the heart cannot pump enough blood and oxygen to support other organs in the body. It leads to high levels of illness and death, reduced ability to carry out daily activities, a lower quality of life, and also place a heavy burden on healthcare systems. Unfortunately, this disease usually gets worse over time, and at the moment there is no cure. Some common symptoms include swelling or edema, fatigue, and shortness of breath, but it is important to note that these are not specific to heart failure, which can make diagnosis more challenging. Heart failure is a major global health challenge. In 2017, nearly 64 million people were living with heart failure worldwide, and around 30 to 40% of these patients have a history of hospitalization due to the condition, highlighting the severity and complexity of its management. Most of the economic burden of heart failure comes from direct costs, particularly those related to inpatient care, hospitalization, readmissions, and the management of non-cardiovascular comorbidities. This places a significant strain not only on patients and their families, but also on health systems, underscoring the need for effective proactive care strategies. Heart failure is often interconnected with other chronic diseases, including ischemic heart disease, hypertension, diabetes, chronic kidney disease, and arterial fibrillation, and also obesity, creating a complex web of health considerations. The interconnectivity manifests in various ways, influencing identification, diagnosis, and treatment of these conditions. HF and comorbidities may have the same risk factors, same symptoms, or one disease may increase the risk or severity of the other. Therefore, it is important that comorbidities should be taken into account and be treated. Heart failure is often called an invisible disease because symptoms are not always visible or easily detected. Some patients with heart failure may not fully understand how serious their condition is. However, pharmacists can play a vital role in improving patients' knowledge of heart failure and its potential consequence if they do not manage their condition effectively. By understanding risk factors and symptoms, patients can take proactive steps to manage their heart health and reduce their risk of heart failure. Pharmacists can improve patients' knowledge of heart failure by, for example, providing easy-to-read, accurate, and up-to-date heart failure educational materials, explaining key terms and tests that a patient may need in accessibility, patient-friendly language, providing information about the impact of the disease can have on daily activities and quality of life, and also guiding patients to primary care services as needed to reduce the risk of hospitalization and readmission. To support pharmacists in managing heart failure, the Heart Failure Pharmacy Toolkit has been developed to help community pharmacy teams start the heart failure conversation and make their moments spent with heart failure patients matter. The Heart Failure Pharmacy Toolkit has been designed to enhance patient interactions and minimize the burden on workflow in community pharmacies. This toolkit supports community pharmacy teams in effectively identifying patients at risk and providing motivational counseling to empower those who would benefit from heart failure assessment and management. You can access the Heart Failure Pharmacy Toolkit via the FIP NCD's microsite. Simply go to the main NCD areas, select cardiovascular diseases, and then click on Toolkit. The Heart Failure Pharmacy Toolkit was designed to motivate and support community pharmacy teams in establishing or enhancing a pharmacy-based program for the assessment and management of heart failure. Its 4 core elements aim to upskill pharmacy teams on the value of a standardized approach to heart failure, integrated this into the pharmacy workflow, and promote collaboration with prescribers to improve patient care. The first element is the Heart Failure e-learning module, a foundational training module that uses a case-based approach to build core knowledge about heart failure. It draws on principles of guideline-directed medical therapy where appropriate, helping pharmacists apply evidence-based care in real-world practice. The second element is the Heart Failure Pharmacy Assessment Tool. This is a conversation-based tool designed for pharmacists and pharmacy team members where appropriate to support patient counseling. It helps guide discussions around heart failure risk, screening options, and how better manage the disease. The third element is the Heart Failure Pharmacy Patient Information Leaflet. This is a printed handout to be shared by a pharmacist or a pharmacy team member with the patient that can be used to summarize the pharmacist-patient interaction and provide supplemental information. And finally, we have the Heart Failure Pharmacy Primary Care Referral Letter. This is a personalized letter that can be sent by pharmacists or pharmacy team members where appropriate to the patient's primary care physician. It explains why the pharmacy is reaching out and outlines how both professionals can collaborate to support the patient's heart failure management. I will now provide a more detailed overview of each element within the Heart Failure Toolkit, so you can see how they work in practice and how they can be applied in your pharmacy setting. The Heart Failure Learning Module is a self-study module that is recommended to be completed by all pharmacy staff who will be participating and helping to deliver the Heart Failure Pharmacy Toolkit program. This module was designed to enhance the pharmacist's knowledge on heart failure and the pharmacist's role in helping patients achieve better health outcomes over the course of their disease journey. In this module, you will find several chapters with content to help you better understand this disease and its comorbidities, how to manage heart failure and the role of the pharmacist in heart failure care. You will also find a case study, learning checkpoints, and a glossary of common terms. The assessment tool has 2 distinct pages, the Heart Failure Development Risk Assessment Tool and the Heart Failure Symptom Assessment Tool. The Development Risk Assessment Tool was designed for pharmacists to help them provide a standardized patient-pharmacist conversation flow to support identification of those who may be at risk of developing heart failure. In this document, you will find a flow chart of questions you should ask your patients to understand if they are at risk of developing the disease. You will also find conversation triggers for patient consultation about the risk of developing heart failure, suggested counseling points for at-risk patients and a reminder about the importance of reporting symptoms to facilitate early diagnosis and management of heart failure risk. The heart failure symptom assessment tool was designed for pharmacists to help them provide a standardized patient-pharmacist conversation flow to support the monitoring and assessment of heart failure symptoms. It is designed as a prompt to start a conversation on the importance of symptom monitoring and symptom management to help prevent hospitalization. The symptom assessment tool includes conversation triggers, a symptom assessment flow, a symptom checklist, and practice considerations based on the patient assessment. The assessment tool has been designed to streamline patient engagement so that the heart failure services can be easily integrated into everyday pharmacy practice. It also reinforces pharmacists' behavior and habituates their role as interventionists in heart failure management. The assessment tool takes about 5 to 10 minutes to complete with each patient, and we recommend that you offer the patient a private place to sit and talk. The patient-pharmacist conversation record is a leaflet for patients that can be used to summarize the pharmacist-patient interaction and provide supplemental information. It allows the patient to review important information provided by the pharmacist about the risk of developing heart failure or the risk of worsening symptoms for those already diagnosed, and includes information such as what is heart failure, why are patients at risk of this disease, how to report symptoms, and what can patients do to reduce the risk of heart failure or worsening symptoms. A pharmacist should fill in and print the patient information leaflet on demand to share with patients during or post assessment. And this tool takes less than 3 minutes to print and share with the patient. The heart failure pharmacy primary care referral letter is a personalized letter to be sent by pharmacists to the patient's primary care physicians that explains why the pharmacy is reaching out and how to partner to support the patients with heart failure. This 4-page referral letter has 4 key sections: an overview of the purpose of the letter addressed to the prescriber, a risk factor summary checklist, an actions to taken by the pharmacy checklist, and a recommended assessment checklist. The referral letter has been designed to simplify the documentation and referral process so the pharmacist can quickly capture relevant information and recommendations to support further assessment of the patient and to help build a collaborative relationship. And this letter should take less than 3 minutes to complete and to be sent to the prescriber. An infographic was also developed. This infographic is a 1-page digital visual aid that serves as a quick reference guide on where, when, and why to use the heart failure pharmacy toolkit in pharmacy practice, with quick links to the toolkit's practice resources. In summary, this toolkit will help you to recognize and identify patients at risk of heart failure or with heart failure symptoms, to start a conversation and take action, and also to collaborate with primary care. In conclusion, pharmacists as accessible primary healthcare providers are ideal positioned to support better management and outcomes for patients with heart failure, building on their existing involvement in cardiovascular risk factors management. And there are multiple opportunities within the pharmacy for at-risk screening and symptom management interventions. FIP publications in the field of cardiovascular diseases include the Cardiovascular Diseases Handbook for Pharmacists and the Cardiovascular Diseases Knowledge and Skills Guide. These resources outline the knowledge and skills pharmacists need to deliver effective services for cardiovascular diseases and serve as a valuable complement to the heart failure pharmacy toolkit. Both publications can be found on the FIP and CD's microsites. I hope this video was help you better understand the Heart Failure Pharmacy Toolkit and how it can support your practice. Thank you for watching.